There's a ton to consider when deciding whether or not you want to have children. Can you afford to properly raise a child? How many children do you want to have overall? Are you willing to sacrifice your goals and dreams for a child? But there's more to look at than that. There's a set of factors that mothers in particular must address when planning a pregnancy. Pregnancy planning is a concept that encompasses setting goals and taking steps that set up the best possible environment for the fetus and mother and for the prevention of pregnancy-related problems. These issues will be the subject of our discussion in this lesson. One of the key issues to consider when planning a pregnancy is any medication or supplements you may or may not be taking. You're surely aware of all the commercials touting side effects ranging from sore throats and coughing to cancer and death. Lovely. Well, the problem is that some medications can go from a mom's bloodstream to that of the baby's and negatively affect the fetus. Therefore, some medication can actually harm an unborn baby and cause birth defects or even miscarriages. Your doctor can help you figure out if a medication you need for something is potentially dangerous to the fetus. Again, the reason medication taken by you can affect a growing baby is because a mother and her baby are connected anatomically and physiologically, and some drugs can cross from the mother's bloodstream to the unborn baby. A developing fetus is like any other developing and immature living organism. Great care must be taken to preserve its life. On the flip side, there is the fact that when you're planning a pregnancy, you may actually want to take some supplements or medications to prevent problems. For instance, a doctor might recommend that a mother-to-be take folic acid or vitamin B9 in order to help prevent a birth defect called spina bifida, a condition where the fetal spine fails to close. Sort of related here is the issue of discussing any medical conditions you already have with your doctor if you're planning a pregnancy. This is because some types of medical conditions can increase the risk of complications to or from pregnancy. These conditions include asthma, hypertension, which is high blood pressure, diabetes, obesity, thyroid disease, and epilepsy. You may be wondering why or how these conditions affect pregnancy, and luckily, we'll have time to discuss one of these in this lesson a bit more. Let's pick the last one, epilepsy. There are many things to consider when planning a pregnancy if a mother has epilepsy. Epilepsy, by the way, is a central nervous system condition where the brain experiences recurrent seizures. Your brain is an electrical nerve center, a computer, which can sometimes go haywire. It's sort of like when a real computer starts doing odd things like throwing hundreds of pop-ups on your screen for no reason, likely because some computer code went a bit crazy. These seizures can cause premature birth, injury to the fetus, and even affect the heart rate of the unborn child. But the condition itself isn't the only thing to watch out for. Anti-seizure medication may contribute to infertility and birth defects. All of this is by no means trying to imply that people with epilepsy shouldn't be planning a pregnancy or should stop taking their medication without a doctor's approval. Quite the contrary. With proper planning and oversight by a doctor, most women who have epilepsy will have healthy babies. Equally importantly, pregnancy planning involves the avoidance and cessation of other kinds of drugs. In other words, the cessation of any use of alcohol, tobacco, and illegal drugs. The latter three are well implicated in causing all sorts of problems for pregnant women and unborn children. Let's take a look at one of them in particular. Alcohol use during a pregnancy is associated with fetal alcohol syndrome, a condition that causes mental and physical problems to a baby as a result of a mother drinking alcohol during her pregnancy. When a mother drinks alcohol, the alcohol goes into her bloodstream and then reaches the baby. It's the same thing that happens with the medications I was talking about before. And just like some medications can harm an unborn child, so can drugs like alcohol. Problems associated with this syndrome include birth defects such as heart defects, behavioral problems, learning difficulties, growth problems, and a small head, small upper jaw, and narrow eye opening. Of course, there is a lot more for a woman to consider when planning a pregnancy. These issues include eating healthy, getting enough sleep, Making sure important vaccines are in order, especially for chickenpox, hepatitis B, and German measles. Screening for sexually transmitted infections such as HIV, gonorrhea, chlamydia, and syphilis, as well as taking age into account. This is because fertility issues, loss of pregnancy, and some diseases are more likely to occur in pregnant women over the ages of about 30 to 35. And finally, don't forget about family history. Both partners and a doctor need to figure out if they have a family history of medical conditions that increase risks to the pregnant woman or unborn child. Clearly, there's a lot to consider when it comes time for pregnancy planning, a concept that encompasses setting goals and taking steps that set up the best possible environment for the fetus and mother and for the prevention of pregnancy-related problems. Of particular note is ensuring medications you are using are safe to take while pregnant. That, and kicking any bad habits like illegal drug use. While drinking alcohol in moderation may not be a bad thing when not pregnant, alcohol use during pregnancy may result in fetal alcohol syndrome, a condition that causes mental and physical problems to a baby as a result of a mother drinking alcohol during her pregnancy. While avoidance of drugs, legal or otherwise, are things of note, equally importantly is the need to remember that some medications and supplements should be taken to help avoid complications related to pregnancy. As an example, a doctor may advise a pregnant woman that she take folic acid or vitamin B9 in order to help prevent a birth defect called spina bifida, a condition where the fetal spine fails to close. A doctor will also assess the mother to be for any medical conditions she may have that can increase the risk to her health or that of the unborn child. Medical conditions such as asthma, hypertension, which remember is high blood pressure, diabetes, obesity, thyroid disease, and epilepsy. Other necessary factors to remember when planning a pregnancy include making sure important vaccines are in order, especially for chickenpox, hepatitis B, and German measles, and screening for sexually transmitted infections such as HIV, gonorrhea, chlamydia, and syphilis, all of which can harm a child.